since 1843, we had kindergartens attached to our primary schools. But some of them didn't survive due to financial constraints until 1961, when we had the structure for content for education. There was some recommendation for kindergartens to be parts of the education structure.
Our biggest challenge has been the teacher gap. We don't have the qualified number of teachers teaching at the early childhood education, even though there has been a series of attempts to help teachers to improve their academic qualifications in that sector. We also have a gap in infrastructure and materials.
Ghana is a really unique country to study and think about early childhood education. It's been a pioneer on the continent in expanding 2 years of pre-primary education called kindergarten as part of the universal free basic education system in the country. So because this policy was rolled out in 2007, Ghana has made tremendous strides in increasing access to an enrollment in kindergarten education. The key issues the government is now grappling with is how to ensure that that education is high quality and that children are really learning and developing to their full potential by having access to early childhood education. The FastTracked Transformational Teacher Training Program, or FTTT as we call it, is a model program designed to support teachers in their pre-service training to become kindergarten teachers. It's an intervention that includes training, monitoring, and support both for the student teacher and the kindergarten teacher, who is really the key trainer for the student teachers. The program sets up model practice classrooms to give student teachers a sense of, when they are then placed as full-time teachers, what their classrooms could and should look like, how to implement the kindergarten curriculum within those model practice classrooms. And the goal is to get teachers ready to then go on and start their own teaching career wherever they're placed around the country. In partnership with Innovations for Poverty Action Ghana, the Ghana Education Service, and Sabre Charitable Trusts, we designed an evaluation to understand the impacts that this FTTT program was having, both on student teachers during their training year and the following year when they're placed as full-time teachers. So 135 student teachers completed their coursework at the Holy Child College of Education in 2015. And Sabre Charitable Trust only had enough funds to support half of them in the FTTT program. So we randomized student teachers to either be placed in an FTTT school or placed in whatever placement school they would have been assigned to otherwise. And we were able to then track these student teachers over the course of that year and then follow them as they were placed throughout the entire country and follow them in their first year as what is called newly qualified teachers. In that final year as newly qualified teachers, we were able to do a whole set of classroom observations, surveys with teachers, as well as assessing the learning and development of the children in their classrooms to understand how FTTT was transforming teachers' experiences and ultimately classroom practices. As student teachers and the following year as full-time teachers, those who were trained in the FTTT schools had much higher knowledge of the kindergarten curriculum, as well as implementation. They were using many more of the activities and structural resources from the curriculum in their classroom. Impacts that were very large, over 2 standard deviations. We also found that teachers had more motivation if they were trained in the FTTT program specifically around teaching, and higher rates of personal accomplishment. And these persisted as they were the following year as they were placed as newly qualified teachers. One unexpected finding is these teachers were less satisfied with their jobs as they became full-time teachers. By the final wave, which was 1 year after their training, all of those impacts essentially faded out. So by not having ongoing support, the differences between the treatment and control group by the end of the first placement year had basically disappeared in terms of classroom quality. The Quality Preschool for Ghana program was a partnership between myself and my colleagues, Larry Aber and Jerry Bierman, a partnership between us, Innovations for Poverty Action in Ghana, the Ghana Education Service, which is part of the Ministry of Education, and the National Nursery Teacher Training Center, one of the premier teacher training centers in the country. And our goal was really to find scalable ways to improve the quality of the kindergarten education sector in the country. So working with lead trainers in the country, we've developed an in-service teacher training to support teachers to use the curriculum for kindergarten, which is actually a wonderful curriculum. Many teachers, however, are not trained on it. So to actually train them on the curriculum and then to provide ongoing coaching and monitoring and feedback for teachers throughout the year as they integrate these practices into their classrooms.
We took 240 schools in the Greater Accra region and we assigned them by lottery to business as usual, to the teacher training program, or to the teacher training program plus a parent awareness in the component. So we had 3 groups: business as usual, teacher training only, and teacher training plus parent awareness. If you assign schools by chance, by lottery to those 3 conditions, and you follow them over time, any differences that emerge, you can safely say is caused by the teacher training program or the teacher training program plus the parent awareness program. So these kinds of random assignment studies are how we get good medicines, how we get all sorts of things in the world. They're kind of the basic science of learning in human development.
Once upon a time, I wrote a letter to the zoo to send me a pet. So they sent me an elephant.
We found that the teacher training was very effective in improving classroom quality. Teachers were using many more elements and activities from the curriculum in their classrooms. The quality of interactions between teachers and children, which are really the drivers of children's development, was improved. Teachers' rates of burnout were reduced. Actually, we found very large reductions in teachers feeling emotionally drained from their work. And as a result of that, we actually saw very large reductions in teacher turnover rates, primarily in the private sector. So by virtue of engaging in this training, teachers were much more likely to stick with their jobs through the end of the year. And for children to have a consistent teacher for the entire school year is a really big gain. We also found that these differences in classroom quality and teacher professional well-being appear to translate into improved outcomes for children. So we found positive impacts on children's school readiness, which is a composite measure of behavioral and academic skills. When we broke that down, we saw that was really driven by impacts in multiple domains: children's early literacy skills, early numeracy skills, and also their social and emotional development.
IPA has been a really wonderful partner to academics like us doing this kind of work. Because IPA has field offices in over 20 countries, one of them being in Ghana, they're here for the long haul. They're making relationships with schools, with ministers, and so they are able to help researchers tune into the policy and practice debates and help the policy and practice communities learn more about research. The implications of the research for practice are that it is possible for teachers to become more skilled, more sensitive, more effective in the classroom. And when they do, children learn more. And that's a very positive message. We don't have to sit and have untrained teachers. We don't have to sit and let children not be as ready for school as parents and communities want them to be.
Together, both of these studies inform the broader goal of improving young children's education in Ghana. Both show the potential for transforming teaching practice to support the national curriculum and integrate more child-friendly pedagogy, and that when teachers implement these practices, children learn more and develop their social-emotional skills. If implemented together, the FTTT and QP4G training models have the potential to truly transform kindergarten education in Ghana.